Welcome back. Tonight, we're going in focus to address a critical public health crisis in our country when it comes to gun violence and how it affects our community. So joining us now is Dr. Richard Ferguson. He's the president of Black Physicians of Utah. Thank you so much for joining us tonight.
No, thank you for having me.
It was really interesting when you mentioned, we were talking earlier in the break, how you were comparing COVID and how the community addressed that to how we could address gun violence in our country. Tell us a little bit about that.
I think we have to approach gun violence just in the same way as COVID, because it wasn't just the federal government that we relied on to do something. We actually went to business sector. We looked into public health departments, state leadership, and also our hospital systems. We just can't think all of it is just going to be done through federal regulation to eradicate or try to reduce gun violence. And I think that's the bigger point. And one thing is, we did a lot of research early on and quickly because we saw how many lives were being taken by COVID-19. Well, we haven't really done a lot of funding research to understand gun violence, particularly prevention programs that are most effective, and other forms of restrictions and safe gun ownership, and further regulations that still respect ownership in the Second Amendment. There are things that we can do now, local level and a federal level, but also it will need business, nonprofit sector, education to be involved in addressing it, just like we did with the pandemic.
You mentioned research. Is there any particular area that you would like to see more focus on to find some more answers?
I think one would be research into the desire to acquire or seek assault weapons, because I think many of us, particularly those with a military background such as myself, and currently, you don't need it for hunting, and you don't need a semi-automatic rifle to defend your home. There's lethal means out there that can address it. And also, when do we stop that escalation? Right now, I'm pretty sure that the founding fathers weren't thinking about an assault weapon when they were writing the Second Amendment. So I think that's where we need to research what is the best way to rein in the lethality of the weapons that are currently out there and reducing their number.
And we were just talking about a shooting that happened yesterday in Chicago, and you were talking about the impact that it has not only on the people who were out there when that happened, but on first responders and people who are trying to treat those people who were impacted by this.
Yeah. As someone that has taken care, so I served in Iraq in 07, 08, and actually to give a little more precedent to our figures, majority of often gun violence results in suicides. Those were actually my first two soldiers I lost in Iraq were due to suicide. Often they were, I think, rushed to deployment, probably shouldn't have been there. But I also took care of gunshot wounds while on my base and while in theater. And the biggest thing that I felt was traumatizing was for us, and we volunteered to go and serve and put ourselves in harm's way. Civilians that were in that parade north of Chicago yesterday, Philadelphia, the EMT, the emergency room responders, the ORs, what they are seeing, what they are becoming privy to is what we all only thought we would deal with, which is the shock and trauma in a war zone. What may be experienced by Russian and Ukrainian soldiers right now. But no, it's happening right outside our front door. And I think we need to address that just as vehemently as we have taken the COVID crisis seriously.
How can we support people who, maybe haven't gone through that specifically, but are experiencing that, whether they're in a hospital or they witnessed a violent crime like that?
So I think there's two things. We need to also think, I'm here speaking more so from the healthcare provider perspective. We have to make sure that our providers are supported as well, so that there's trauma counselors available for them. But yes, there's going to be quite a few survivors. I mean, I was impacted just yesterday hearing about what happened in North Chicago, and it made me tear up knowing that my brethren that were taking care of them, but also what's going to happen to those families afterwards. I think sometimes we focus on the number of people that were killed or injured, as opposed to the hundreds or thousands that continue to be impacted and threatened by this constant violence.
And when you talk about numbers, I had a friend who said, it could be 1,000 or 1,000,000, but if it's one person that it makes a world's difference, and that can leave a lasting impact.
Yeah, so I think trauma counseling, but paying counselors appropriately, making sure that they can get effectively licensed and sometimes easily go from one state to another. There's sometimes barriers to that. It's not a lot of reciprocity for someone that says, I'm in Illinois and I want to help out with a mass shooting, or I want to go and help out in Utah, or I want to move there. It's not as easily done. So there are things that can be done at the state and national level, but also to incentivize people to become mental health counselors and trauma counselors. It's just unfortunate that we need so many.
It certainly is, and you definitely gave us a lot to think about. Dr. Ferguson, thank you so much for joining us.
No, thank you.
And you can find more information on our website. That's at abc4.com.